the topic is the Pharyngo esophageal diverticula. So the first question we would like to ask is, name the site of the Lammer's diverticula. So in this video we'll find the answers to this question and learn in detail about this topic. So to begin with, first we'll be dealing with the Zenker's diverticulum. So the Zenker's diverticulum. So the Zenker's diverticulum, the weak space. First we need to know what is the weak space. So in such a case, the weak space is the Killian triangle. It is a Killian. The Killian triangle or the Killian dehiscence. Dehiscence. So this is the weak space. Next we'll be looking at the site. What is the site actually? The site is above the upper esophageal sphincter. It is above the upper esophageal sphincter. This is the site, and it lies between the oblique fibers. It lies between the oblique fibers and the oblique fibers of the thyropharyngeus. Oblique fibers of the thyropharyngeus muscle. And the horizontal fibers of the cricopharyngeus and the horizontal fibers of the cricopharyngeus muscle. So now let's just recap what we did here. So we dealt with the Zenker's diverticulum. The Zenker's diverticulum, the weak space is the Killian's triangle or the Killian dehiscence. What is the site of this Zenker's diverticulum? The site is, it is above the upper esophageal sphincter, and it lies between the oblique fibers of the thyropharyngeus as well as the horizontal fibers of the cricopharyngeus. So TP and CP muscles, between them it lies. Whereas in case of TP it is oblique fibers, in case of CP it is a horizontal fibers. Then we'll be moving ahead with the Lammer's diverticulum. So when you look at Lammer's diverticulum, the weak space. The weak space is the Lammer's triangle, as the name suggests, Lammer's triangle or the Lammer's Hackermann area. So what is this site? The site is, it lies posteriorly and it is below. It lies posteriorly and below the cricopharyngeus and above the longitudinal muscle layers, and this is of the esophagus. So let's just recap. We saw the Lammer's diverticulum. So Lammer's diverticulum, the weak section or the weak space is the Lammer's triangle and the Lammer's Hackermann area. So the site is, it is posteriorly below the cricopharyngeus and it lies above the longitudinal muscle layer of the esophagus. Then lastly we'll be looking at the Killian-Jamieson diverticulum. So the Killian-Jamieson diverticulum. So this Killian-Jamieson diverticulum, the weak space is the Killian-Jamieson area. Now what is the site? The site is, it lies laterally, and this is between the oblique and the transverse fibers. It is between the oblique and transverse fibers. So it lies between the oblique and the transverse fibers of the cricopharyngeus at its attachment. So it is attached to the cricoid cartilage. So let's just recap here. So we saw the Killian-Jamieson diverticulum. So the weak area here is the KJ area, that's the Killian-Jamieson area. The site is, it lies laterally between the oblique and the transverse fibers, that is the OT fibers of the cricopharyngeus, and that is attached to the cricoid cartilage. So after this we'll be answering our question. So the one question we asked was, what is the site of the lamens diverticulum? So lamens diverticulum, it lies posteriorly. It lies posterior, and it is posterior below the. It lies posterior. It's below the cricopharyngeus and above. It lies below the cricopharyngeus and above the longitudinal muscle layer of the esophagus, and above the longitudinal muscle layer of the esophagus. So let's recap. So the lamens diverticulum, it is present posteriorly below the cricopharyngeus and above the longitudinal muscles of the esophagus. So this was about the pharyngeal esophageal diverticula. To learn and grow daily, please do subscribe.